Today on the Frontline Health Podcast.
Antibiotics are similar in the sense that if you've got a bacterial infection, it's going to kill that bacterial infection, but it doesn't necessarily keep those infections from coming back because they'll continue to attach to the bladder lining. And that is, especially if you've got an underlying risk factor, is one of the reasons why we see so many people coming back again and again and again with UTIs, but they're continuing to also develop an antibiotic resistance over time just because they're being treated with antibiotics so often.
Welcome back to the Frontline Health Podcast, where we share news, tips, and insights to help you take ownership of your health. I'm Evan Patrick. Troy Duell, founder and CEO of Centurion Health, is here with me. If you've ever had a urinary tract infection, you probably remember it. They're painful, inconvenient, and unfortunately for many people, they just don't happen once. Some women seem to get them over and over again. They finish their antibiotics, feel better for a while, and then a few months later, or even a few weeks later, they're dealing with another one. Today we're asking a simple question: why do some people keep getting urinary tract infections? And perhaps more importantly, is there anything you can do to help break that cycle?
Yeah, I think this is one of those topics that is incredibly important because those recurring urinary tract infections affect millions of people each year, and it seems to be one of the most talked about when you talk about antibiotics, and probably one of the things that can have even greater detrimental effects on our health if we're taking antibiotics too much. And hopefully there, as we get done with this podcast, we'll have some ideas on ways that you can go about helping to prevent them and keeping from having those recurrent UTIs if you already have them. So excited about talking about UTIs.
Yeah, absolutely. And as we kind of get started here, I really would just like to shine a little bit of light on how big of a problem UTIs are for many people. It's not something that has personally affected me. And so for a long time, I really didn't realize how big of a problem they are, and that they're really one of the biggest reasons for hospitalizations in the United States. My personal experience with it came when my grandma, as we've mentioned before, that's Meemaw, because we're from the South. But she started dealing with them, and for a while it seemed like she was getting one really every few months, and it just continued to be something that was coming up and just making her life more difficult, causing her pain, just disrupting things that she had planned, and just disrupting her life and leading to kind of some scary unwanted trips to the doctor. So I really started digging into it a little bit more, learning more about these recurring UTIs, and a lot of women really struggle with these. And so if you're a woman out there and you're listening to this, hopefully this will be helpful. And Troy, could you share just a little bit more information with our audience, maybe if you're not familiar with how widespread UTIs are, just to help them understand how big of a deal this is?
Yeah, it's a really big deal. Obviously, it's one of the most common bacterial infections that we see out there, and they can actually be incredibly devastating if they occur in the elderly because they can cause an altered mental state. I don't know if you've been around anybody who's had a UTI before and they're a little older, but they can actually begin to hallucinate, start saying some really crazy things, and they're often admitted to the hospital, and family members are really kind of freaking out because it's totally out of the ordinary for those individuals to act that way, and they wonder what's going on. And thankfully a lot of times they'll catch it early and they don't have to go through that for a long time, but it's certainly one of those things that happens more often than we'd like to see happening. And like you mentioned, it happens in women much more often because of the anatomy of a woman than it does in men, but it can happen in men as well, and especially older men when you start to talk about catheters and everything else. But on average, a woman will experience about one UTI during their lifetime, and they'll often have recurrent infections, and unfortunately some of them will have to be hospitalized or visit the urgent care because of them.
Yeah, thank you for sharing that, Troy. And I think all this really just goes to show, and the point we want to start with is just that this is not some rare problem. It is very common.
Very, very common, and primary care physicians see it constantly. A lot of the urgent cares out there see this on a regular basis, so it's not something that is a very rare occurrence.
Absolutely. So, what we're going to get into is the causes and treatments that are available for UTIs in just a minute. But it seems odd to me. So many women who get UTIs get them over and over again. So let's start by just talking about what exactly qualifies as recurrent.
Typically, when we say something is recurrent about a UTI, it means that they've had two infections within about 6 months, or they have three within 1 year. Once somebody reaches that point, it's kind of really, if your physician isn't looking to other reasons as to why that infection keeps recurring, then they're doing you a disservice. And instead of just treating the symptoms, you need to start looking at what is actually causing this UTI, and is there a way to keep it from happening again?
Okay, so we're talking about these infections of the urinary tract, and as you just mentioned, recurring is you're having these over and over again within a certain time frame. But what actually causes a UTI to start with? So let's start there. When someone gets a urinary tract infection, what's actually happening in their body?
Yeah, most of them start with a bacteria. The most common bacteria that we see that cause UTI is actually E. coli, that same bacteria that we always talk about with chicken. But it normally lives in the digestive tract, but then it can get to the urethra and it travels into the bladder. And once it gets to the bladder, that's when the infection really begins. So, not every exposure, just like not every time you're exposed to a virus or a bacteria do you get a cold or the flu. Not every time that your body is exposed to E. coli in that area do you get an infection. But at first, really has to attach to the lining of the urinary tract. And once it attaches, that's when it can start to spread and cause that infection.
So that's kind of when the problem comes in, not just the presence of that bacteria, but that bacteria actually grabbing onto the lining. How does that even kind of happen?
Yeah, so there are strains of E. coli that have tiny hair-like structures called fimbriae, and those fimbriae kind of act like hooks or Velcro that attach to the lining of the bladder, and then it can't be flushed out with urine, and then it just starts to grow.
Okay, so that seems pretty simple, right? You've got the E. coli and other bacteria attaching to the uterine wall and the uterine lining, and that's how an infection starts in the first place. But as we kind of introduce this conversation, you know, many women do not just experience one UTI and get better. So what are some of, you defined kind of there the frequency within a certain time frame they're getting these infections again. What are some of the main reasons that someone may be getting these over and over again and it's not just a one-time thing that happens, they get better and move on?
Yeah, I think there are a couple different reasons that are out there. Obviously, we talked about anatomy earlier being a part of the reason that women have that happen more often, and that really comes with hygiene. Making sure that you're teaching your kids how to have good hygiene and proper wiping techniques after going to the bathroom, that is a big part of what happens. But then there are some bacteria that are really better at sticking around or reestablishing itself on the bladder, then that can cause another infection. And then there are certain risk factors that also come into play. So if you have an increased sexual lifestyle or sexual activity, if you use certain forms of birth control like diaphragms or spermicides, if you're of the age that you're at menopause and you're starting to see a decline in estrogen, we know that that tends to lend itself to seeing more infections. If you haven't emptied your bladder completely, you could have urinary tract abnormalities. And if you have diabetes, those can all add up to meaning you'll have a greater frequency of UTIs. And then, of course, if you've already had a UTI once, there's a greater chance that you're going to have a UTI again. And then finally, it's good to remember that repeated courses of antibiotics are really necessary to treat an active infection, but they can disrupt that beneficial bacteria, disrupt the gut microbiome, and that causes you to actually be more susceptible to getting another infection because your body can't fight off the bad bacteria with the good bacteria. So making sure that you're not just taking antibiotics just to take them, but that there's a reason for it, and then you're replacing it with some probiotics is a big part of this strategy.
Hey, Frontline Health family. If you're enjoying this conversation, please go ahead and like this episode and subscribe to the Frontline Health podcast. It really helps us reach more individuals who want to take ownership of their health. And comment down below, what is a health topic you'd like us to investigate in a future episode? Leave your suggestions in the comments, and I promise we do read all of them. Together, we're building a community that values health stewardship, and now, let's get back to the episode. Yeah, it's pretty easy to see how that can become a cycle. Like you said, if the antibiotics that, are seen as sort of the cure can also then contribute to more infections down the road, that can be a vicious cycle that kind of repeats and repeats. And we'll get into some of the lifestyle aspects of this later on in the episode, but I know one of the big things for people I have known is hydration. They don't drink enough water, and so they're not flushing those things out of their system frequently enough, and some other things that people can do just to kind of help their lifestyle, and even some things that they might be able to take before they're experiencing an active infection if they know that they're susceptible to that might be able to help as well. But we do know antibiotics, if somebody gets a UTI and they go to the urgent care or they go to their primary care physician, their urologist, whoever, antibiotics are going to be the first thing that they go to. So why are antibiotics not just kind of like the answer? If that is what we're going to, why are antibiotics not always enough?
Yeah, I think it's similar to if you have an issue with your car and you treat it just long enough, say it's your battery, and you jump it and you're able to get to another place, but maybe it's an underlying cause that your car is not able to recharge that battery, then it's going to keep happening again and again. Antibiotics are similar in the sense that if you've got a bacterial infection, it's going to kill that bacterial infection, but it doesn't necessarily keep those infections from coming back because they'll continue to attach to the bladder lining. And that is, especially if you've got an underlying risk factor, is one of the reasons why we see so many people coming back again and again and again with UTIs, but they're continuing to also develop an antibiotic resistance over time just because they're being treated with antibiotics so often.
Yeah, and I think it's important to highlight what we're talking about here really kind of gets at the heart of this podcast and of, our company as a whole is taking ownership of your health and not necessarily waiting until things start happening in order to, try to fix a problem, but really taking ownership of your health and being proactive to do what you can do to make sure that you're going to stay in the best health possible, and being aware of those things that can happen. And we know, as you've just kind of laid out for us, treating an infection and reducing the chance of another infection aren't necessarily the same thing.
That is exactly right. And hopefully that's what you get from this podcast and from us as a company, is the idea that we want to get to the root problem of what's going on and try to avoid going towards an antibiotic if at all possible.
Absolutely. So one thing that we know has been getting a lot of attention from urologists lately, and from pharmacists, from anyone who has patients or people coming in that they are trying to help with these recurring UTIs that they're having. One of the things that is starting to be recommended is something called D-Mannose. There are a lot of natural ingredients, but this is one of the most studied and one that is gaining a lot of attention today. So Troy, I would love it if you could just talk about, what D-Mannose is and kind of how it can help.
Yeah, it's kind of crazy when you think about it, because D-Mannose is really just a simple sugar, and that simple sugar is found in a lot of fruits like cranberries, apples, peaches, and even oranges, and could be why we see so many people doing well when they drink cranberry juice or something else in trying to avoid getting these further bacterial infections or UTIs. So, but what is interesting about D-Mannose is that it's not really used by the body the same way glucose is. So it's not one of those sugars that's used like glucose, but it's typically absorbed and then filtered by the kidneys into the urine, which means it's going to end up where the urinary tract support is most needed. So it hits the place that we really need it.
Yeah, and it's really, I love the way that this works. I was going to ask if you can kind of explain what's actually happening with the biology of how D-Mannose is interacting with that bacteria, because it's really a pretty simple mechanism.
Yeah, so we mentioned earlier that E. coli is the main bacteria that we see with UTIs. And what E. coli does when it gets into the bladder is it actually binds to what's called a mannose containing receptor. So, what researchers found is that free D-Mannose in the urine, we just talked about how D-Mannose is broken down and excreted through the urine and gets into the bladder. The D-Mannose binds to those bacterial structures instead, and then that bacteria latches onto that D-Mannose instead of the bladder lining, which means it's then flushed out during urination, and you no longer have that bacteria attached to your bladder.
So instead of like the antibiotics that are trying to kill the bacteria, what the mannose basically does is it just binds with that bacteria so that your body is able to flush it out a little bit easier and it doesn't have the chance to bind to the lining.
That's right. And it gives your body enough time to really break down that bacteria on its own and making sure that it's not multiplying on the lining to then cause that urinary tract infection.
Makes a lot of sense, and it really is cool how simple some of these things can be when you look at it. Um, I know one of the things that we always want to ask. There are a lot of fad supplements that hit the market. You know, there are stories, people go crazy about them. Some of them there is a lot of promise behind, and people get great results from. But some of these things that people talk about online are not necessarily backed by research. So we want to ask the question: what is the research saying to us about D-Mannose?
Yeah, I think the evidence on this is really pretty encouraging. So there have been several clinical studies that have shown D-Mannose may actually help recurrent UTIs in some individuals, particularly those infections that are caused by E. coli, which we already talked about because E. coli goes to and binds with the D-Mannose as opposed to the bladder wall. And other trials have showed that recurrent rates have gone down comparable to certain preventative antibiotic strategies. So instead of taking an antibiotic on a regular basis to try to prevent that, they're giving them D-Mannose, which is super promising and super helpful because you're not going to have antibiotic resistance that builds up. So I think it is certainly a potential tool for urinary tract health that deserves our attention and probably deserves to be tried, but understanding that just like with any medication, even if it's a prescription, whatever you take may not work for you. It's not going
That's
to work
right.
for everybody, but it is, and it may depend on what the bacterial infection actually is, because if it's not E. coli, there's a good chance it may not work for you.
Yeah, that's absolutely right. And we're not giving anybody any medical advice. We would always encourage anyone who is considering taking something new. Talk with your healthcare provider about what is right for you. But can you paint a picture for us of a candidate who might consider starting to take D-Mannose?
Yeah, I mean, I think if anybody has been experiencing recurrent UTIs, it's similar to being told by your doctor to start drinking more cranberry juice. This is just another opportunity to give your body a chance to fight off whatever bacteria it may be. And we know that, especially anyone who's had issues with E. coli, that is going to be a super target for somebody to take D-Mannose, and they will be a great candidate to take it and have some good effect from it. But I think it's always important to remember that if you have persistent symptoms like fever, pain in your sides, if you get blood in your urine, especially, or if you're a man and you start to get infections, those could be signs of something a little bit more dangerous, and you should not wait and go get evaluated by a healthcare professional as soon as possible.
Okay, so thank you for breaking that down, Troy. That's a lot on D-Mannose. We know that as we mentioned earlier, there are a variety of things that people can do to really take ownership of their health if they have been struggling with recurring UTIs and they want to do everything that they can do within their power to make sure that their body has the best chance of not getting these or of being able to manage these infections when they do set in. So can you talk about maybe are there other things? You mentioned cranberry juice a minute ago, or lifestyle modifications, things that people can do to really take ownership of their health if they're dealing with or concerned about urinary tract infections?
Yeah, I think we can start with those supplements. So we talked about cranberry juice, cranberry extract, taking them in capsules. Hibiscus is another one, dandelion. So it seems like D-Mannose, cranberry, hibiscus, and dandelion have the best data behind them on how to use a supplement, or in order to use a supplement to help reduce UTIs. But you mentioned another one earlier, staying well hydrated. I think that is a key because that's going to help flush all those toxins and bacteria out of your body. Making sure that you're emptying the bladder regularly, urinating after sexual activity, because that certainly holds on to bacteria. Managing those underlying conditions that we talked about, like diabetes. So if you can get that under control, there's going to be less likelihood of developing a UTI. And then avoiding using antibiotics while you're treating infections. If you don't have to use an antibiotic, that's going to be big because you're not going to mess up your gut microbiome and keep your body from being able to fight off those infections on its own. And then, of course, working with your doctor or healthcare provider if you get infections on a regular basis, because they can come in and give you a plan and a strategy, if they're good, to help you overcome these recurrent UTIs that you're having, and hopefully peg what's really going on.
That's amazing, Troy. Thank you so much for sharing just those helpful tips with people for how they can take ownership of their health. And today's takeaway, I think, is that recurring urinary tract infections, they often involve more than simply catching another infection. There's a lot that goes into it. Understanding how bacteria attached to the urinary tract has opened the door to new nutritional approaches like D-Mannose that may help people support their urinary tract health. And as always, don't ignore the symptoms of a UTI. If you think you have one, especially if you're experiencing a fever, severe pain, vomiting, or you're pregnant, be sure that you're seeking medical care promptly. If you enjoyed today's conversation, be sure to subscribe. Share this episode with someone who could benefit from it. Even if you have not dealt with urinary tract infections, there are so many people who do. And be sure you leave us a review on this podcast. It helps us reach more people with evidence-based health education like what you heard today. So, as always, go out, take ownership of your health because you are your best health advocate. We'll see you next time on the Frontline Health Podcast.